Hi everyone, happy Women Wednesday and hope you're doing well. Today we'll be discussing Cervical Health Awareness Month, which is this month of January. So excited to talk about vaccines and cervical cancer prevention and just getting screened regularly. If you are in need of HIV or STI testing, please feel free to give Whitman-Walker a call at 202-797-4439. You can schedule an HIV or STI test. During the COVID-19 pandemic, hi Whitman-Walker. During the COVID-19 pandemic, Whitman-Walker's community health team has expanded its outreach efforts to include the social media platform. We cover various topics around HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. And again, today we're going to be discussing Cervical Health Awareness Month. So every January marks Cervical Health Awareness Month, and it's a time used to bring awareness to and increase education about cervical health. Cervical health is vital for anyone with a cervix or folks who were assigned female at birth and may not identify as women. Well, may or may not identify as women. According to the National Foundation for Infectious Disease, or NFID, human papillomavirus, or HPV, more affectionately known, is the most commonly sexually transmitted infection in the U.S., and it's the cause of almost all cervical cancers in people with a cervix or women in the U.S. as well. So nearly 80 million individuals in the U.S., most in their teens and early 20s, are infected with HPV, and more than 12,000 people with cervixes or with a cervix in the U.S. are diagnosed with cervical cancer each year. But up to 93% of these cases are preventable, and this disease can be prevented with vaccination. So a handful of facts about cervical health include that HPV is transmitted through sex, and half of all sexually active people will get HPV at some point in their life. It also will present with no symptoms, so you can easily have it and not know that you have it. HPV infections usually go away on their own, but if they don't, they can cause cervical cancer. There's two main types of HPV, which are number 16 and 18, that cause 70% of cervical cancers and precancerous cervical lesions. Cervical cancer can be cured if diagnosed at an early stage and treated promptly. But again, it's super hard to know if you have it unless you're getting screened regularly. Most women and people with a cervix should get screened for cervical cancer between the ages of 21 and 65. Now let's talk about the vaccine. So the best way to prevent cervical cancer is with the HPV vaccine. Available options in the U.S. include Gardasil, Gardasil 9, and Cervarix. So Cervarix prevents infection with types 16 and 18, again, which are the most common types of HPV that represent 70% of all cases of HPV. Gardasil prevents types 6, 11, 16, and 18. And Gardasil 9 prevents infections with 5 additional HPV vaccines that include the 31, 35, 45, 52, and 58 types. But again, of course, they include those 6, 11, 16, and 18 ones as well. So HPV vaccination is recommended for preteens, teens, and certain adults. And everyone through ages 26 years old should get HPV vaccines if they are not fully vaccinated already. HPV vaccination is not recommended for everyone older than 26 years old. Some adults ages 27 through 45 who are not already vaccinated might choose to get the HPV vaccine after speaking with their doctors, but it's kind of just about the risk for new HPV infections and possible benefits for vaccination for them. HPV vaccination of adults provides less of a benefit just because, as you get older, it will experience more people who've already had or been exposed to HPV. And so let's just go over a quick summary from the American OBGYN Association in terms of guidelines for cervical cancer screening. So people with reproductive anatomy who are ages 21 to 29 should have a Pap test alone every 3 years. HPV testing alone can be considered for people with reproductive anatomy who are 25 to 29, but Pap tests are preferred. Women and people with reproductive anatomy who are ages 30 to 65 have 3 options for testing. They can have both a Pap test and an HPV test every 5 years. They can have a Pap test alone every 3 years, or they can have an HPV test alone every 5 years. And then after the age of 65, you can stop having cervical cancer screenings if you've never had abnormal cervical cells or cervical cancer, and you've had 2 or 3 negative screening tests in a row, depending on the type of test that you took. There are a few exceptions to that guideline, so you might need more frequent screening if you have a history of cervical cancer, if you're living with HIV, if you have a weakened immune system, if you were exposed before birth to DES, it's a hormone given to pregnant women between the ages of between the years of like 1940 and 1970. And then finally, if you've had a hysterectomy, you may still need to be screened. And if you've had the HPV vaccine, you should also still follow the guidelines, as the vaccine does not protect you against every type of HPV. Finally, you definitely want to see your gynecologist annually, or go and get your pelvic exam annually, according to the ACOG, again, the American College of OBGYNs. Whether or not you are due for cervical cancer screening, you should still see your OBGYN at least once a year. And during your visit, you and your OBGYN can talk about any number of common concerns, such as problems with sex or birth control or pregnancy planning or pelvic pain or abnormal bleeding. You can also talk together about whether you need a breast exam or a pelvic exam, as well as testing for STIs. And if you are searching for an LGBTQ-friendly place to go to for pelvic exams, depending on how you present and whether you've had bad experiences in terms of healthcare and just people not being affirming of your gender presentation, definitely seek out places like Whitman-Walker. Or if you're in a major city, there's usually a Whitman-Walker organization or health center that you can access. COVID brought along so much virtual health. So if you're not able to go in person, you could at least start with a virtual appointment and see what might be an option for you in terms of a affirming place to go for care. Thanks so much for taking some time to learn about Cervical Health Awareness Month. Before we go, I just wanted to share a few reminders about HIV and STI prevention and testing and services through Whitman-Walker. Again, if you need to access testing services, you can call 202-797-4439 to schedule an appointment. And definitely visit the website at whitman-walker.org/testing for the most up-to-date hours and location information. If your community or organization is interested in Whitman-Walker providing mobile health services in your neighborhood, you can contact mobile health at whitman-walker.org. And you can access HIV prevention tools like PrEP and PEP or start treatment for HIV at any of Whitman-Walker's health centers in Anacostia or near Logan Circle. Finally, because we're living through multiple public health pandemics, if we want to talk about COVID-19 before we go. So just a few reminders about vaccines. If you've already been vaccinated, congratulations. You've taken a really important step toward preventing yourself and your loved ones and your communities from getting sick. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask, as the vaccine is not 100% effective. And more contagious variants continue to spread. And there's also just fewer protocols in place in terms of verifying vaccination statuses and whatnot. But all in all, just stay alert. If you haven't been vaccinated and you're not looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please reach out to them at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with them, or there's not regional for you and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. And if you have not been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's super important that you consider getting the vaccine and discuss COVID precautionary measures with those who are around you, but especially if you do not know whether a person has been vaccinated or not. So be mindful, wear your mask, and keep your distance. Finally, because we're in more than one public health emergency, according to the CDC, there's been more than 29,000 documented cases of monkeypox in the U.S. And if you're in DC, you can pre-register for a monkeypox vaccine appointment at preventmonkeypox.dc.gov. Virginia is working with local care providers to contact trace and identify those who are most in need of the monkeypox vaccine, but definitely visit the Virginia Health Department for more information. And then the Maryland Health Department released a pre-registration system that you can use to register for a vaccine appointment. No matter where you are, please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. DC Health monkeypox vaccination locations are walk-up locations, and they're provided on a first-come, first-served basis to eligible residents, and the hours and locations vary day by day. So again, you can see the latest testing hours and locations by going to preventmonkeypox.dc.gov. And please remember to follow the Whitman-Walker family on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website at www.whitman-walker.org for more information on their services. For more information on COVID-19 resources and just general services, you can call them at 202-797-4439. That's the same number you can call to schedule an HIV or STI testing appointment. And again, that's 202-797-4439. And finally, follow us on the Whitman-Walker family programs at RealTalkDC _ and at NoFilterDC. Have a wonderful rest of your